seizures since she was 4.
Okay.
But the type of seizure that she has, she's not awake, but she like runs throughout the house and like bangs against the wall. And she has like no idea what's going on.
That's the seizure.
Yeah.
I mean, there's so many different types. It's probably a complex partial or a simple partial where people have these changes, but they're not, the whole brain is not involved where they're falling down. I mean, sometimes people can be experiencing something and not know how to react and then run around because they're afraid of it. They're not knowing what it is, and especially if it happened when she was younger, they may just have a fear of what's going on during that time and then having this reaction to the seizure that we're not seeing.
Yeah.
So sometimes that can happen.
I have a question about, I'm on Vimpat.
Okay.
I had anaplastic sarcoma. Is there anything in the future coming out to do better than Vimpat? I'm under the impression, and maybe I'm wrong, that Vimpat's like the latest thing.
And there's always things coming along in the pipeline, but there's nothing that I know of that's coming out like in the next 6 months kind of time frame. But Vimpat, I think it's already been out for 3 to 4 years now. So it is the latest of the seizure medications, and it's been having people have been having very good responses to it with low side effect profiles, and I think with better efficacy than some of the other newer medications where sometimes the side effects were much better, but the efficacy was not necessarily there. So I don't know if anything really coming very soon in the pipeline.
I have a question. When a person, has a tumor and, they're prior to surgery, they're having a lot of seizures, and then after surgery, a lot of times they could be seizure-free and put on maybe medication for, precaution.
Yes.
How, is there a protocol for how long do you wait? Does the person need to stay on it forever? Can they, I see Nancy shaking her head, yes. Is there a day you can test not having the medication,
So
weaning off of it?
in general, the recommendation with tumors is people who present with tumors as their primary presentation of the brain tumor, they tend to always have seizures. So people who presented with something else, like they passed out or they had headaches and they had another reason to have that initial diagnosis, once that diagnosis had been, then people still during the treatment phase, during surgical, post-surgical, they may have had seizures in that later phase. So now that you take away that you're not having seizures, you're not directly post-op, you're not post-radiation, and you're not having chemo. Like when you're out of that time period, usually most epileptologists, 2 years. You have to be seizure-free for 2 years to be even talked about weaning off of medication. Because if you go 2 years without 2 years without a seizure, there's less likelihood. But then again, if your primary presentation of your brain tumor was epilepsy, you're going to be at higher risk, they've seen in the studies. So those patients we tend to ask to stay on medication.
Like my wife, she has a grandma seizures, and they're like very deadly. That causes brain damage too.
The actual seizure,
Yes.
it's the ones that last long time.
They last over 30 minutes.
I mean,
And lost, I don't know, the last one, I don't know if they lost it because they took like over an hour to get to the hospital. They had to get a special unit for her. And when they came out of the ambulance, and then only thing I heard, I couldn't get no information out of them, is we got a pulse. Now, could she have passed during the seizure and coming back? Because they had to pull over and wait for another special unit to come with her. And then when she went to the hospital, they were nervous she didn't come out of it for almost a day.
if seizures last that long, sometimes the longer the seizure lasts, the more autonomic dysfunction that can happen, meaning that your heart can go into a bradycardia and your heartbeat can become very slow, and pulses sometimes are hard to find. But so that's probably what was happening at that period, like during the emergent situation. And sometimes even after people stop seizing, their brain is still seizing. And then when we put them on the EEG monitor, they're in what we call non-convulsive status. So the brain continually has seizures, but you're not seeing the clinical manifestation of it. So then there's a whole, that's when we start adding like the IV medication. Sometimes we actually put people in medically induced comas. So we really stop the brain from whatever wacky thing it wants to do, and we just let it rest. And then after a period of time, when we see that the EEG does not have any seizures at that point, then we give it a day, or we give it whatever deemed amount of time, and then we start backing off the medication. Sometimes when we back off on the medications, you start to see those patterns of seizures again, and you bump it back up. So that unfortunately does happen when people, their brain just gets too revved up and it can't stop itself, because usually seizures are self-limited, but that there are those cases and circumstances when they're not.
Is there any kind of a protocol or something that maybe they should look into, knowing that she has a tendency for these type of seizures? I mean, I don't know if you're seeing an epileptologist, which she is, who specializes in epilepsy, or a regular neurologist. So
I mean, typically the way to stop these seizures is not an oral medication. It's an IV medication, which is hard for people to have at their home. But there is Diastat, which is a rectal preparation of basically a benzodiazepine, and that can help to temporize, at least to stop the seizures or try to decrease them while you're waiting for help.
Yeah, they gave us that.
So that's really the mainstay of what you can do at home when those kind of seizures occur.
Right now, it's been, what, about a year?
It'll be 2 years.
Almost 2 years now without a seizure from the last
Good.
one.
Good.
So, we just
Yeah.
wonder how long, could they always come back? Is there a good
So
chance?
in your particular circumstance, when seizures have gone to the point where you've developed status epilepticus or even non-convulsive status epilepticus, that would be the scenario where, even though it's been 2 years, that I would recommend you to stay on medication. Like, that's not somebody you want to play with and say, oh, like, let's see if you have a seizure, because then most people, if their seizures are self-limited, they'll have the seizure, but then you put them back on medication, their seizures are controlled. But in that kind of circumstance, I would worry that the seizure that we let out is going to be one of those.
It was from the tomb, that was from the
So
tomb.
that would be for the rest of her life then?
I think in that circumstance that my recommendation would be lifetime anticonvulsant therapy, yes.